Enero ngayong taon nang maibalita ang pagkamatay ng isang babaeng edad 39 matapos umunong sumailalim sa glutathione at stem cell treatment sa isang klinik sa Quezon City. Kasunod nito, hinikayat ni Department of Health o DOH Secretary Ted Herbosa ang publiko na piliin ang mga accredited facility para sa anumang stem cell therapy procedure. Kabilang dito ang Lung Center of the Philippines, Makati Medical Center, St. Luke's Medical Center Incorporated sa Quezon City at sa Bonifacio Global City, National Kidney and Transplant Institute at ang Asian Stem Cell Institute Incorporated. Sa pagbisita sa Pampanga ng isa sa mga nangungunang stem cell scientists sa Estados Unidos na si Dr. Eric Woods, ibinahagi nito sa isang exclusive interview sa CLTV36 News ang mga salik na kailangang isaalang-alang bago sumailalim sa stem cell therapy.
You want to make sure that you're considering and asking about the source, where the stem cells are coming from, how they were produced, what types of materials were used to produce them, how they were stored, and how they're going to be administered. You want to make sure that these are from reliable sources, particularly if you're a human being from a human, that they're grown in appropriate media, defined media, and that they're stored and transported cryogenically, so very cold, really, to keep them completely intact when they're actually provided to you clinically.
Kailangan din umunong alamin ang dose nito, gayon din ang comfort level, at kung gaano na karami ang procedure na isinagawa na executor nito. Taliwas naman sa alam ng nakararami, hindi lamang ginagamit ang stem cell therapy para sa aesthetic purposes o pagpapaganda.
There are many. This particular type of stem cell is both a potent anti-inflammatory as well as a very useful for regenerative purposes. So any immune type of mediated inflammation, so like anything from autoimmunity to arthritis, anything that needs like joint injuries, those types of things. Also in very clinical arenas, they're useful for organ transplant in some cases. They can even be useful for Crohn's disease. There are currently over 3,000 registered clinical trials in the U.S. looking at these. So 65 different indications. 12 major categories of diseases. Way too many for me to tell you.
At sa loob ng ilang dekadang pag-aaral, mayroon na umunang ilang advancements at pambihirang tagumpay sa stem cell research. Kagaya na lamang na pagkadiskubre kung paano ang tamang pagpepreserba sa stem cell, gayon din ang mekanismo na nakasisira rito. Maaari umano itong maitagos sa loob ng ilang dekada o posibleng maging ilang daang taon. Pinaalala rin ni Woods ang ilan sa mga ethical considerations sa stem cell therapy.
I think it's also unethical to provide false hope to people, to tell people that something's going to work that likely is not. I think it's dangerous to use animal-derived stem cells in human beings. I think you can have some potential viral considerations that could be deadly, could cause pandemics. And safety is an utmost concern. Even beyond efficacy, they have to be safe.
Sa darating na panahon, nakikita raw ni Woods ang posibilidad na makatutulong ang stem cell therapy sa maraming tao.
And it's at a point now where it's really starting to make sense. The mechanisms, the way to utilize them are making sense. Over the next 10 years, I predict kind of a revolution. As I mentioned, 3,000 clinical trials. If a small percentage of those are successful, imagine how many people are going to have a positive impact from these cells. Finding better methods to manufacture them in large quantities at less cost will allow everybody that needs them to have them. So I really think we're right at the beginning of seeing some tremendous activity.
Liana Canilaw, CLTV36 News.